Hi everyone, my name is Tim Reha, host of Informed Health 2016 here in beautiful San Francisco. We're at UCSF and excited to introduce Tom Nesbitt, who's our moderator of our panel. And why don't you tell everybody about your background?
Sure, I'm a Associate Vice Chancellor at UC Davis Health System. I direct the Center for Health and Technology, which is a center that's dedicated to looking at technology-enabled models of care. And I'm also the medical director for the Center for Information Technology Research in the Interest of Society, which is a center that focuses on a number of innovations for the benefits of Californians. And in that, we work on healthcare, and I have been involved in technology and healthcare for a couple of decades now, and this is a very, very exciting time for this field.
And you can probably hear the noise out here. Everyone's just coming out for a coffee break. It's been a huge day here. Let's go into the panel. So we were talking about extended care from the hospital to the home and telehealth. And you help structure and bring together some of the rock stars in this space, really creating innovation. What happened inside, and what was kind of the goal of the panel and the outcomes you're trying to achieve?
Well, the goal of the panel was really to talk about how to move the locus of care for patients from outside institutions to where they are in the community, to try and really make patients the center of the care process and use technology to monitor their physiologic data, to provide them with information about how to change certain things about their healthcare treatments, and do this all in the context of their home and in their lives. We had a great panel. We had David Lindeman, who works with me at Citrus. We had John Hickson, who works at UCSF in the VA Medical Center, who works on neurology and patients with epilepsy, and taking some of these technologies and using them to help care for patients in their home. And then we had Steve Steinhubel.
He's for the digital medicine director for Scripps.
Right. And at Scripps, they're doing some really exciting things with these technologies. And I think that the panel really, reflected a broad view of how these technologies can really change healthcare.
And it seemed really interesting about the tectonic plates that we're moving here in innovation. It seems like we're at an inflection point where we're going to start to really see some new models take place that replace a lot of the broken systems.
Yeah, I think what's really going to change this, a lot of these technologies have been around for a while, but I think this is really going to start changing in a very rapid way. And there's several reasons. One is that people are realizing that we're not really getting the outcomes for the money that we're spending in this country on healthcare. But probably what's going to move things the fastest is the fact that reimbursement models are going to change, where we're going to begin to see that we're going to be reimbursed for outcomes rather than the process of care, and that's really going to move people to use these technologies. I think a couple of things that you're going to see. I think you're going to see that whereas in the past we've moved patients to the expertise rather than moving the expertise to the patient, which we're going to be able to do with technology. In the past, we've treated only in institutions in pretty high-cost settings. Now we're going to be able to treat it in the home and in the community. And I think in the past, physicians and healthcare providers have controlled patients' information, whereas in the future, patients are going to have control of their own information and be able to work in partnership with their clinicians in order to have them get the best health care.
What is happening over at Citrus, and what opportunities do you provide for the community, entrepreneurs, and partnerships you're trying to create to extend the network?
Yeah, so Citrus really involves not just healthcare, but Citrus involves people in the College of Engineering, people in anthropology, people in public health, and we're coming together in multidisciplinary teams to tackle some of the big problems. And we have teams that are working on robotics in healthcare. We have teams that are working on wearable sensors to measure physiologic data. We have teams that are doing a number of things around video processing to create 3D telemedicine so that doctors can see patients in 3D when they're seeing them over distance. And one of the other things we're doing is we're trying to help entrepreneurs that are in the academic settings develop potentially spin-off startup companies through our foundry. And we also have something called the Invention Lab, where we can have entrepreneurs bring some of their ideas there and get multiple inputs from multiple disciplines about how to improve the innovations that they're developing. And it's really an exciting time to be part of that kind of an organization.
So Tom, I'm an entrepreneur, and I know a number of entrepreneurs are really curious on how to connect with you. Do you have a website, or what's the best process, and what's the route to connect?
Sure, so the best way is either to look at the website for the Center for Health and Technology at UC Davis, or the Citrus website that's managed out of UC Berkeley, and you'll see a lot of the things we're doing, and you can certainly connect with me through LinkedIn, and I'd love to be in touch with anybody who's interested in the work we're doing.
What I love about what's happening here at UCSF is all the collaboration that's happening from corporate and all kinds of different organizations within the university, and then entrepreneur activity. Well, Tom, that was great. Thanks for wrapping it up, and thanks for hosting the panel today. Is there anything coming up for you that's exciting?
Well, I think the next event that we're going to be spending a lot of time at is the American Telemedicine Association, and that's going to be an exciting event where we're going to be talking about a lot of the same issues.
So that's the ATA event coming up. That's Tom Nesbitt, and thanks for being on the show and moderating the panel today.
Thanks a lot. Really appreciate it.
Cheers. Thank you.